The Community Mental Health Transformation Programme forms part of a national programme set out in the NHS Long Term Plan to enable adults with severe mental illness to access care and support in a new, more joined up and effective way, regardless of their diagnosis or level of complexity. This is about offering flexible and personalised care and support that responds to an individual's mental health needs and preferences close to home, while also increasing support for the wider factors that can impact wellbeing. Health and care providers are working more collaboratively with local authorities and voluntary and community organisations to support and address the wider determinants that impact on mental health. So, why are we doing this? Population health management has been a huge part of the transformation programme. So far, we have looked at patient data and discovered priority groups and communities that are at high risk of serious mental illness. This process has enabled us to establish a clear set of priorities which will address unwanted variation in access to care and improve holistic support at a patient and community level. These priorities are financial wellbeing, housing, lifestyle, future focus and co-occurring needs.
System partners, service users and their carers are at the heart of this transformation. Co-production will help develop services that combine lived experience with traditional clinical skills. This will facilitate a more person-centred service that is focused on the user's needs based on users' experience and what is important to them and their general well-being. The framework allows for a shift to a new model of community mental health provision, designed on an asset-based view of communities and integrated working across agencies.
To make sure the service user is at the heart of everything we do, our new look services will be integrated into our mental health teams to ensure a seamless approach to service provision. So let's meet our partners. Delivering our financial wellbeing services will be the South West Citizens Advice Bureau in the West and Mercian Citizens Advice Bureau in the East.
The Financial Wellbeing Management and Support will be a service that offers a range of flexible support to people with financial difficulties within the Staffordshire community. The service will offer advice and support to patients contacting the mental health service, whose mental health problems are worsened by issues relating to financial instability and challenges. We aim to support service users with underpinning financial challenges and signpost them to relevant partners. We also provide information and advice about debt prevention, budget management, consumer rights, and income benefit optimization. The delivery of our housing support provision will be supported by a consortium of providers either through housing specialist or direct delivery of the service.
This service will provide a variety of quality housing and support services to meet the needs of service users in maintaining and accessing sustainable tenancies, with a particular emphasis on interventions and support within the private rented sector where there is a risk of landlord repossession. This service will encourage and facilitate independence, quality of life, health and well-being by providing practical advice, information and support on a wide range of issues to promote personal independence.
Delivering our future focus pathway will be changes in the West and Burton Mind in the East.
The Future Focus pathway will enable participants to stay well in their recovery journey. The service will be person-centred, which means the way in which people can be supported will be flexible and will help people to make the best use of their community resources. The Future Focus pathway will work with individuals who have severe and enduring mental health needs. Some individuals are likely to require regular support to enable them to build a trusted relationship with their named support worker to aid their recovery journey. This will involve working together to develop SMART goals from areas including things like wellbeing and employment, spirituality and sleep pattern. Progress will be reviewed regularly to enable development of new goals if required and to reflect on achieved outcomes. Individuals who may have additional complexities will require a more intensive and at times a longer support to aid their recovery.
Delivering our lifestyle services across the South will be Everyone Health.
Studies have shown that service users with serious mental illness have huge disparities in health outcomes and life expectancy. A key factor of this is underactivity and being overweight, which contribute to a much higher prevalence of long-term health conditions. The lifestyle service will have a focus on increasing physical activity levels amongst service users. There will also be guidance on weight management, healthy eating and education. It will not be a traditional weight loss programme, but will be primarily to support service users to eat healthily, be more active and enable them to have better wellbeing and have a positive impact on their mental health.
Delivering the co-occurring needs service will be Humankind.
ICON is the integrated co-occurring needs pathway. Its ultimate aim is to ensure that adults with mental health and substance use needs across South Staffordshire are supported to achieve their goals for recovery.
Spanning voluntary, community, social enterprise, primary and secondary care services in South Staffordshire, ICON is a tiered trauma-informed model of care which focuses on engagement, choice and strengths. It promotes integrated working, offers consultation and coordinates shared training opportunities to those working with individuals who have co-occurring needs.
ICON is confident that by working together towards shared goals, individuals with co-occurring substance use and mental health needs can achieve change and find a better balance in their lives.
Many voluntary community and social enterprise organisations across Staffordshire provide invaluable mental health and wellbeing support and have a wealth of experience, knowledge and community insight. The current focus on community mental health transformation should include the whole of the voluntary community and social enterprise mental health sector. This is a brand new way of working where voluntary services will be integrated into mental health teams. Our partners will have access to our clinical systems for notes along with access to diaries so that we work together as a single entity to ensure the service is seamless from a service user perspective. We know that this is a big change for our teams. Research has proven that this will help to improve outcomes for the communities that we serve. With all of your help, we can really transform the lives of service users and those who care for them in our community.
We have worked with NPFT to identify key trends, challenges and priorities for our communities and to set about getting them on the community mental health transformation.
By working in partnership with local VCSE partners, NPFT can provide a coordinated approach to care which will make a real difference to our Staffordshire population.
Ensuring health and care decision makers hear the views of communities which experience the greatest health inequalities.
This will make it easier for all communities to access services and will reduce health inequalities.
Bringing the expertise of the VCSE sector and the communities they work with will help to free up clinical capacity.
We hope you have enjoyed our introduction to our new look services. This is an exciting time for community mental health services, a journey that will make a true difference to service users and the Staffordshire population.